Welcome. You're watching A Closer Look at Palliative Care. I'm your host, Toni Kayumi. Our guests today are Barb Palmisano from Northeast Ohio Medical University. We also have Sue Howson and Dr. Sarah Friebert from Akron Children's Hospital. We appreciate you spending time with us to answer some questions after watching that wonderful documentary. If we could talk a little bit about, to start, the educational learnings that came from watching the documentary, what people were trying to impart by telling the story, and what we're hoping people will come away with.
Well, Toni, we're hoping that the film will have national impact. That originally when we started the film, we were thinking medical education fairly locally, but we realized that we needed to showcase the diversity of the families that could benefit from the palliative care services and the range of services, that whole palette of care that they so individualize and target to the family, specific to their needs. So what we're really hoping, and we all firmly believe, that this documentary belongs in all of health professions education, and that we would like to see it a mainstream so that all students experience and know exactly what this kind of care is all about. And what better way? You can't give it in a lecture, you can't do it in a case discussion. Not as compelling as having the families literally come into the classroom. You can see the children, see the families, hear the team members talk about what it means to them, what their role is. It's so vitally important. And so far when we've shown it, it's made a great impact. We're very excited about it. We also think not only for training our future workforce with other nurses and social workers and pharmacy students, chaplaincy students all across the board, but we're also seeing this as training teams and helping. If you train and educate students in silos and then throw them together in a clinical setting, they don't know how to act as a team. They don't really understand what everybody's roles are. So at NEOMED, we really highly value interprofessional education, and so we're hoping this is a great tool to showcase this, because what Sarah and her team have are the true spirit and really the true meaning of team, and we'd like to see that transported across the country.
Now, if someone viewing the program would like to get access to having a copy of their own to view or to be able to share with others, how can they do that?
They can do that on either of our websites at NEOMED or Akron Children's Hospital. We are fortunate to have an Office of Palliative Care, so at NEOMED, so it's listed under ours, and Sarah, I believe it's listed under your program.
It is. akronchildrens.org/palliative care will get you right there. You can get your very own copy.
And neomed.edu.
Now, when we're talking about palliative care, who is it actually for?
We've defined palliative care very broadly, Toni, so we really want to be there for any child with a chronic, complex, and or life-threatening condition, and that's really a lot of children. I think many people think of palliative care as being for children who are very sick or about to die, and that's certainly true. But these days, the definition is really much more upstream than that. So any child who has a tough illness journey, any family facing an uncertain journey with a child whose prognosis may actually turn out to be quite good, but nevertheless, they're going to have a rocky road along the way. And what we've really tried to do is bring that whole palette of services to help that family along that journey.
When we talk about the differences between palliative care and hospice care, could you expand upon that?
Sure, that's such a common question that we get. And hospice care is a vitally important form of care that's available also for families and people facing really closer to the end of their lives than we talk about generally in palliative care. So some of the confusion comes from the fact that hospice has also worked its way upstream to be much more open-ended. But nevertheless, in hospice, we really do focus more on people who have a terminal prognosis of some number. The government actually defines that as having 6 months or less to live. In pediatrics, we tend to expand the definition beyond that. But in palliative care, we're really talking about children who may live for days or weeks or months or years or decades. We've had our program now for 12 years, and we have some patients in our program who have been there since the very first day we opened our door. So there's really no time limit. That's one of the biggest differences. Hospice care, again, tends to be focused more toward the time when your life is coming to an end, and we're really there for the entire journey in palliative care.
How does adult palliative care and pediatric palliative care differ?
Adult palliative care is a model that's been around actually far longer than pediatric palliative care. Pediatric palliative care is a relatively new discipline, and it focuses much more on the acute situation. No disrespect meant to our palliative care colleagues in the adult world, but the focus is much more time limited, much less of a focus on outpatient follow-up that extends for many months, weeks, years, decades. We also have a great penetration into the community in the pediatric world, so our palliative care team extends to wherever these children call their home. We go to schools, we go on home visits that may be in their homes, it may actually be at their best friend's house, it may be where they're playing sports, kind of wherever the child is living his or her life. Children have illness journeys that are very unpredictable, and each child really writes his or her own book as he or she is going through the journey. And so our care has to be extremely flexible and meet the needs of the family along the way. That's not necessarily different from the adult palliative care model, but the focus really tends to be on a broader family, on even the community, on anyone that child's life is touching. And we also know that the depth of support that's necessary in the pediatric palliative care world tends to be far more complex. Whenever you have a child who has a life-threatening condition, it creates a huge ripple effect, and not just the immediate family, but the extended family, the grandparents, the neighbors, all the folks in church, all the kids in the classroom, the teachers, everybody is very affected by that child's life. And so in the pediatric palliative care model, we have to come up with ways to meet all of those different needs while we're working with children and families who are in and out of the hospital, in and out of an outpatient setting, in and out of an emergency room near them, and in the community where they want to call home.
So speaking about the wide range of services that are available to so many different people who are impacted by the child's illness, can you talk a little bit about the holistic approach, the fact that we're not just focusing on treating the body, we're focusing on so much more with palliative care?
We do approach very, very holistically, and we work very well with all the specialists that these children may be seeing. A lot of children come to our program, or young adults who have seen a wide variety of other specialists in the community and may have been being taken care of by those individuals for a long period of time. So we are able to collaborate, and we are very lucky because we have a depth and a breadth to our palliative team. We have physicians, we have fellows. Right now we have 3 fellows who are doing their palliative training with us. We have nurse practitioners, I'm a clinical nurse specialist. We have social workers, a bereavement specialist, and a myriad of other people on our team, including research assistants. We have an expressive therapy studio under Dr. Friebert's direction, where we have massage therapy, we have chaplains, we have social workers, just a huge variety of people that can help. So we, as mentioned in the documentary, we kind of do a palliative care approach. So not every single service that we have available is appropriate for that child, for that family. So that's what we were able to find out from a really good assessment. We like to say that we do impeccable assessment on every child, every family, to see what their needs are right now and how those needs may change as our relationship with that child progresses and as that child grows.
One of the things that really, sure, absolutely.
Just in terms of the holistic process, I think one of the things that we hear often from families, we just heard this from a family today, is that they work very closely with specialists who understand very well one part of their child's body. So the cardiologist really knows their child's heart, and the neurosurgeon really knows their child's brain, and so on. And I think the difference that we bring is that we put all those pieces of the body together into a whole child who also functions in a family with siblings and with other family members and lives in that community. And so when we say holistic, it's not only the different disciplines that we bring that Sue mentioned that can pay attention to all the different physical, psychological, emotional, spiritual, developmental, and practical aspects of a child's life that can create suffering but also create joy for them. But it's also the ability to look at that child as a whole person and figure out what goals does the family have for that child and how can we best help that family achieve those goals.
The documentary itself, one of the things that struck me was the vulnerability that was shown by the parents, as well as extreme strength to be able to handle the situation. And it just was very clear that they felt so close to the palliative care team, that they had true affection and felt like you were family members to them. How do you train doctors and healthcare professionals to fit that role, to be able to be that source of information, that source of care, and that source of strength for a family?
Put a great emphasis on humanism, and we have a human values and medicine program that is really outstanding, where students read reflections and meet in small groups and really explore that patient-physician relationship that is so sacred and so meaningful. And we put a huge emphasis on our bioethics. We have a great bioethics program as well, and appreciating the patients and the family's culture, who they are as people, respecting them, and our students getting in touch with their own biases. We all don't like to admit it, but we all have biases. Leaving those biases at the door, being non-judgmental, and trusting, knowing you're in the long haul, and really caring about the patients, loving the patients, and knowing what their struggles are. That's why we were so excited about the movie, because it actually, we can't always be bringing the families into the classroom, but how important it is that they hear directly from the family and how meaningful that relationship is. It really is sacred, and we work very hard at it. Communications, just the ability to listen, to sit, and get to know that patient and family so that they can make knowing decisions. We do a lifespan perspective. We have the strong pediatric piece and all the way through the adulthood as well. And we do something where we pair our students with hospice patients through a community hospice agency. And their assignment is to just get to know the patient. We call it hospice patient and family as teachers. And they write reflective papers, and it's a invaluable experience because it is an opportunity for them to realize the importance of exactly what they can do and how they can bring comfort and joy and meaning and healing at the end of the life. And students are always say they learn so much about life from these patients, as well as their philosophy on death and their spirituality and how you get meaning from that.
Sometimes there's a hesitancy of families to reach out and ask for help, to say, I need help, I can't do this on my own. How can we let family members know that it's okay? And the sooner that you get help, the better it's actually going to be for your child, for your family, and everyone connected to you.
That's such a true thing that happens, Toni. I think people really are afraid to ask for help, or don't sometimes even know that there is help available. So I think one of our hopes from this documentary is that we will get the message out that there is this kind of help available, and that's why we're here. And we want to be available so that if anyone knows of a child or works with a family who's struggling, or goes to church with a family, or is in school with a family who might benefit from our services, all you need to do is pick up the phone and give us a call. Sue, our case manager, will be on the other end of the phone, and we're available 24/7 for anyone in our community. We really don't have any geographic boundaries. Our program actually works with children and families who live right now in 46 of Ohio's 88 counties, and we will go and be wherever they need us to be. So we really do want to get the word out that there are resources available. You don't have to be in this yourself. It's frightening and overwhelming enough to have a very ill child, let alone to try to navigate a very complex and fragmented healthcare network out there, and to figure out which way is up while you're trying to take care of your other children and your family and work and manage a household and do all of the other things that you need to do. So help is available. It's just a phone call away, and we are here for exactly that reason.
So if they have reached out, they've placed that phone call, and they're talking to you, Sue, what happens next? I know every story is probably different, but just a general idea of what would happen next for this family.
Well, if I would be talking to a family on the phone, meeting him that way, which happened today a couple of times, and just tell me about your child. So even before, if I would be calling this family back, I might find out some other information that I would be able to glean from other providers or just things that we might have in the computer about that child, to just find out a little bit more so that when I call that mom or dad back, that I have some information about their child. So I do that, and I just tell them, you know, just tell me a little bit about your child's journey, and just I'd like to, just in the few minutes that we're on the phone, get to know who your child is. Why were you referred to palliative care? How do you think we might be able to help you? Let me tell you a little bit about the people that we have on our team and how we might be able to help you. Is your child coming in for an appointment soon with another specialist? Maybe we can meet you then. We try to make it as easy as possible for families to meet us and then to meet with us subsequently after that. Would you like a home visit? It might be a child who is that maybe it's impossible to think of, that we've never met them, that may have a tracheostomy, be on a ventilator. Then of course we would want to, you know, meet them when they would come in for an appointment, or to make it easier for the family to meet them on their turf at their home. We have a very robust home visitation program, and then finding the right people on our team to meet that family. Sometimes medically they are so well taken care of and they have that all taken care of, but navigating as their children get older, the school system, government programs that they may be eligible for, just things that are overwhelming to them. So I tell families, you've done a splendid job working as your child's case manager. Now let me help you and other people on our team.
Now, I know a lot of the times when you have an ill child, there's so much focus on that one child that other siblings sometimes take a back seat. What can be done to help the other children also feel that they are a priority?
We have several team members that specialize in working with the other children in the family, and sometimes those are siblings, sometimes they're actually cousins or even close schoolmates or team members on a sports team, for example. We have a child life specialist on our team who works with children when they're in the hospital, helps prepare them for procedures and for scary things that are happening to them, but also can make home visits and meet with the other siblings and families on their turf, as Sue mentioned. We also have an expressive therapy center, and we have a trained art therapist and music therapist who work with siblings and with the affected children themselves. Many children can't express themselves verbally, but through expressive therapy, through art, through music, through dance, through songwriting, through anything like that, they might be able to talk about their feelings and really be able to work through what's happening to their brother or sister. So we try to offer a variety of different settings, individual and group. Some children respond better to one or the other. We also work closely with families themselves to empower them to be able to talk to their children. Sometimes families come to us and say, we're not quite sure how to talk to our other kids about what's happening to our child who's very ill and in the hospital. And so we work with them to give them the words and help them really work through that. So depending on what the need is, we have a team member to match it. And for some families, we have a psychologist who can also provide individual counseling if that's necessary as well.
And for the caregivers, they too need attention. What can be done for them?
Again, we might have a team member that one or another family member might work with. You know, when you say caregivers, there are actually multiple sets of caregivers. There are caregivers in the home and the family who often are doing care of their ill loved one 24/7, 365, day after day after day, and that's exhausting. And respite care and just the ability to have someone to share that journey with can be very, very important. So we will try to match that family with someone to talk to, whether it's our chaplain, our psychologist, a social worker, or one of us in the clinical team, just to be there and help them process through. We try to be aware of opportunities within their communities where there is respite available, sometimes having a volunteer come over and just give them a break for a couple of hours so they can go out and do something else. Some of the home nursing programs and other things like that. We offer individual and group opportunities as well as fun things that we have access to through many of our generous donors. Will make tickets available or other options for families to just go out and have fun, sometimes with their ill child and sometimes just as themselves. So sending parents out on a date to dinner when they haven't seen each other in a long time because they've been busy taking care of their ill child is something specific we can offer. There are also the caregivers within the healthcare team, too, who do this work and this service 24/7, 365. And as Barb mentioned, it's an absolute honor to walk this journey with these families and be there. But it does take a toll when you have very ill children and you're working with them all the time. So we do a number of things on our own team, for our palliative care team, to take care of each other and ourselves, and we also extend that care to the rest of the medical community. That can be as simple as just individual sessions, debriefings, retreats, specific activities to kind of de-stress, as well as more formal opportunities to really process when something difficult happens and people need to share that and talk about it, to be able to get up and do it all again the next morning.
That too, we talk about that with our medical students as well, and how important that is for the self-care and healing, because to care for someone else, if you can't care for yourself, then you can't function. So we try to emphasize that early on as well.
How can it possibly spread throughout the country so that more families can have access to this service?
It's one of the goals of the film that we, and that was part of my colleague Margie Sanders and I were very committed to doing this film because we wanted to tell the story. We wanted to tell the story of what palliative care is, what's happened. We have a treasure in our community at Akron Children's Hospital, and it's care that should be and can be available with the proper models and the proper advocacy. We showed the film at one of the professional meetings, and afterwards we had someone come up to us, one of our colleagues, and say that she was preparing a proposal to her administrators and to develop a pediatric palliative care program at their hospital, and she was going to use the film because she said, what better advocates than the families and the patients themselves? If I show this film and I can use this in the advocacy to sensitize them to the needs, then she figured I've won my case. So we're hoping this film will help and make an impact.
Almost anybody who asks us to do that, whether it's at another university or doing it within our own walls at the hospital, we want our colleagues to know about palliative care. So we, for the last 12 years, have been part of many educational programs to do that.
We have about a minute left in the program. What is the final message that you would like to share with people who are watching us?
I think if I could say one thing, it would be not to be afraid of this kind of care. One thing we hear over and over from families is, if I had only known what this was all about, I would have wanted you involved in my child's life a lot earlier. And families will say to me all the time, who wouldn't want this kind of care? There's still a stigma attached to palliative care, and we need to get rid of that and recognize that for anyone that we know and love, we would want them to have holistic care that's geared in a individualized way to take care of that child and his or her family. And we just want to make sure that that's available for any child everywhere in this world who might need it.
And if people want to learn more, again, website, phone numbers, contact information that you'd like to share.
AkronChildren'sHospital.org/palliative care, and our phone number 24/7, 365 is 330-543-3343.
And for NEOMED?
NEOMED is neomed.edu. So, and we're through the Office of Palliative Care, and our number, we're always welcome to do educational programs as well. Our number is 330-325-6359.
I want to thank all of you for joining us today. It's been a great opportunity to be able to learn some more information about pediatric palliative care. And then just in one brief final saying goodbye, if there are family members who are watching right now and they're going to call you, Sue, to learn more information or go to the websites to get more details, wanting to share with them that there is help out there, that there are people who care, and that NEOMED and Akron Children's Hospital are available to help.
Absolutely.
So the documentary is going to be available on both of the websites.
Right.
It's also available, of course, on Western Reserve, PBS, and Fusion for people to look on our website. And so this is an opportunity for all of us, again, to say that we care about these families and hope that they'll come with us and learn more. You're watching a closer look at palliative care on Western Reserve, PBS's, and Fusion. Thanks so much for joining us. Take care.